Hi everyone, I am Dr. Lexi. I am your host. I will be answering questions, but before I do, I just want to throw out a disclaimer that this is not therapy. I cannot give therapy in this type of setting, so I just want to throw that out there for ethical reasons. If you do want to receive therapy or life coaching, you can go to my website at www.illmeetyouThere.llc.com. The link will also be put below this video, so you can also click the link. But I am a licensed clinical social worker, which means that this platform is used to pretty much just give my thoughts, opinions, and perspectives on different situations that you pose in my direction. So stay tuned and I'll be answering questions up next. So, first question, does therapy actually work or really work? Yes, therapy does work. However, you have to have buy-in into therapy in order for it to work. So if you go into therapy and you're like, I don't really want to talk to these people, and I'm not going to tell them everything that's going on with me, then already you're starting off on a bad foot, and you can't expect for any changes or anything to occur if you don't trust or feel comfortable with talking to your therapist. We have what we call a therapeutic alliance that we have to build with a client first. So if we're talking to a client or a patient, and we start to feel as though that person just isn't opening up with us, it is our duty as a therapist to say, hey, I noticed that you're being really guarded, and then to talk more into that and decide from there if this is, good to continue to go. There's also being in therapy for 5-6 months and you're not seeing any differences. This person isn't giving you homework to do, or make any lifestyle changes. They're just kind of just listening and doing this to you the whole time. That might not be the best therapist for you. Maybe you need a therapist that does more than just listen, right? Maybe you want them to be a bit more proactive, to hold you more accountable. So that means you need to break up with your therapist and find a new one. Um, Being with a therapist is like being in a relationship, just like being in a relationship with a significant other or even in a friendship. If it's not working, then you got to call it quits. I know for some people, it is scary to call it quits. Um, I would highly suggest not ghosting your therapist. But I have had to prompt. So if you are a therapist and you're watching, and you haven't done this before, I think it's important for you to prompt your person or your client, your patient, whoever it is, and letting them know and saying like, hey, do you actually feel comfortable with me? You know, if you don't feel comfortable with me, then let's find you another therapist, right? And then you kind of help them search for something more of what they're looking for. I'm that way. I know everybody is not going to be that way. I just really value the I really value just people really getting a lot out of therapy. I've heard of horror stories with therapy where therapists make the entire session about them, or they listen and they're really good listeners, but they don't offer any help. I think it's really important to be proactive and to offer assistance, and not just opinions or pushing religion on people. So, therapy, long story short, therapy is amazing. Therapy can be great. I just think that you have to find the right therapist. Therapists are people too. So there's going to be personalities you don't mesh with. It's just important for you to distinguish that kind of earlier on. If you had a month or two of sessions and you're just like, it's not working for me, then it's time to move on and find another therapist. How do I know I need therapy? The easiest question for me. And my answer is everyone needs therapy. Okay. Think of it like car maintenance. Everybody who owns a car um, needs to go on for maintenance at some point or another. And that's the same thing with our brains, with our mental health. Sometimes we just need to check in with someone who is just not associated in our environment or our everyday life and just kind of say, hey, is everything going all right? Am I thinking about this the right way? And then kind of get our answers from there on whether or not we want to continue with therapy, whatever the case is. But honestly, everybody needs therapy. Okay, so if you are in therapy and you are starting to feel the benefits, you're starting to feel the growth and feeling like you have started to have more self awareness and finding yourself, a lot of times that you start to feel those things, you start noticing other people who may have had similar symptoms to you that are around you, whether it be siblings, whether it be friends, parents, even. In our environment, we start wanting those people to change as well because they're not um doing what we think they should be doing, right? And so we think that, oh, they should have this like enlightenment that we had and go to therapy and do the things. Well, you can't force people to do that. The only thing that you can really do in those moments is talk about your experience and how well it has transitioned your life. And from there, you can only hope that people kind of latch on to that and ask you either more questions about it or ask, to how you started your process so that they can do the same. Okay. So you're not ready to go to therapy for whatever reason it may be. I don't know, but you want to make a change in your life. I would start by suggesting that therapy is really great for when you want to make a change in your life because then you can utilize them as more of a accountability coach. They can also help with building objectives for you to then reach your set goals for whatever that change looks like and making it more realistic to you. However, if therapy is really off the table for you, then I would say start by making a small change, something that you see as realistic. So if it's you don't work out at all, maybe it's adding, a few push-ups and sit-ups in the morning before getting your day started to try to make a change. We want to release a lot more of the serotonin, endorphins, dopamine into the body, outside of just being on our phones and scrolling. And, it's really getting more in tune with yourself. So if you want to make a change, I think being consistent and doing something different that's out of the norm, possibly physical activity, if you can help with making a change in your life. How open should you be with your therapist? I think that you should be extremely open, like open book. However, if you find it difficult after a month or two to start really opening up and you're feeling really guarded with your therapist, that just might mean that that therapist is not for you. It's kind of like how I mentioned earlier in the video. You don't want to waste your time, you don't want to waste their time. And so after about a month or two, if you're gauging that you can't open up, you don't feel comfortable with them, then it's probably time to break up with your therapist and move on. Thank you all for tuning in, and let's keep the conversation going. If you have any questions, comments, or maybe there's a myth that you want me to bust, I am more than open to responding to all of your inquiries. So please feel free to hit the like button, subscribe so that you don't miss a chance to ask Dr. Lexi.